As I mentioned before, my name is Christy Brantley, and we are going to do MIPS Made Easy Dermatology and Plastic Surgery MVP. I'm very excited to present this today since it is something new for dermatology and plastic surgery when it comes to the MIPS value pathways. You will hear from Megan and Heather later on in the presentation. We will have a live Q&A with the MIPS experts after the webinar. So go ahead and start logging those questions now, because if we can answer them within the questions link, we will. But I also want to make sure that we can get to everyone's question if there are a lot of questions. Also, you will receive an on-demand recording that will be sent out this week. The information provided in this webinar does not and is not intended to constitute legal or other advice. Instead, all information, content, and materials are available for general informational purposes only. Information in this webinar may not constitute the most up-to-date legal, financial, or other information. Webinar attendees should contact their attorney, financial, tax, or other advisor to obtain advice with respect to any particular matter. This webinar contains links to other third-party websites. Any such links are provided only for convenience, and Nextech does not recommend or endorse the contents of any third-party sites. All right, so let's dive in. So our agenda today, we're going to talk about understanding MVPs. We are going to break down the components of the MVPs. What is the benefits of using MVP versus traditional MIPS? And then we'll do that live Q&A with our MIPS experts. But first, before we start, I'm going to launch a poll question. So let me launch. Okay, so how familiar are you with MVP? All right, so this is going to be good. So we have about 6% that is very familiar, so that's exciting. 53% at somewhat familiar, and we're still kind of moving a little bit here. And then about 39% not familiar. So this is good. This is going to be a great webinar. I hope you get a lot of information out of it for everyone who is somewhat familiar and not familiar. And then the 10% that's very familiar, I hope that I can give you a little bit more information on it, or maybe something you didn't know. All right, so I'm going to close that poll, and we are going to start our webinar. So understanding MVPs. What is an MVP? It's a MIPS value pathway. CMS is committed to the transformation of the merit-based incentive payment system through the MIPS value pathways, MVPs. So you'll hear that a lot is MVPs, which is a MIPS value pathway. MVPs are the newest MIPS reporting option, which is an alternative to traditional MIPS and APMs. So MIPS value pathways is our new reporting option from traditional MIPS. As you know, the program has evolved over the years. So we were PQRS, meaningful use, MIPS, and now again, we're moving into MIPS value pathways. So nothing is ever going to stay the same. It is constantly going to move. Why MIPS versus traditional? Why MVPs versus traditional MIPS? Why are we moving again to something else? Well, traditional MIPS, everything was lumped into one. So all specialties into one group. And a lot of the measures aren't relevant to your specialty. So a lot of the measures that you're using may not even be relevant to your specialty, which can be frustrating sometimes. So a MIPS value pathway is organized by specialty and can contain more relevant measures to that specialty. So it may be easier for you to do an MVP, or you maybe feel better about doing it since it's more relevant to your practice. As I've heard multiple times of being a MIPS consultant is, why am I doing these measures? This has nothing to do with my specialty. So you may find it easier or better to do these MVPs because it is going to be more relevant to your specialty. But why did CMS decide to do MVPs? Well, CMS has been listening to you, clinicians, to the practices, because clinicians have reported that the current MIPS program is too confusing. It's really confusing. It's hard to choose your measures. Clinicians believe there are too many choices when it comes to selecting measures and makes the process too hard. So CMS is listening, even though it may not seem like they are listening to try to make this a little bit easier. And then again, many of the measures that you're using, a lot of times we hear that many of the measures we're using is not relevant to the provider specialty, which makes it very difficult to document or do something that's not relevant to what you are doing. And then it all comes down to being able for patients to be able to compare performance between providers. It's kind of difficult to compare those performances if you're using measures that aren't really relevant to your specialty. There is a MIPS value pathway timeline. So traditional MIPS will go away. It will eventually sunset. They're no longer going to use traditional MIPS. Eventually, you will go directly to MIPS value pathways. That was projected in 2026. Well, 2026 isn't that far away. So, of course, that's probably going to be pushed out a little bit. But the projection was then, again, just remember all of those dates get pushed out. So we will help you stay on top of those things to make sure that you know when that traditional MIPS is going to sunset. But it's very important to know that traditional MIPS is going away. So don't wait to the last minute to get familiar with MIPS value pathways so that you'll be ahead of the game when that traditional MIPS does sunset in the future. So the final rule just dropped today. So you're going to see a lot of things that says proposed in my webinar today because we just received the final rule. So there was 6 proposed MVPs for 2025. I do have the 2 highlighted that could be for derm and plastic specialties. So the dermatological care and the surgical care. I am going to break down the dermatological care MVP a little bit more because that could be used by plastics and dermatology. But for plastics, if you are a plastic group on this webinar, you can also look into the surgical care and see if that is one that would possibly work for you. So just keep those in mind as the measures that would pertain to your practice if you're wanting to use a MIPS value pathway. So there's layers to the MIPS value pathways. You've got the MVP layer. So it's cost, quality, and improvement activities. So you have quality performance. You're going to select 4 quality measures, with one of those being an outcome measure from the MVP list. And I'm going to actually show you that MVP list here in a little bit, but I just wanted to kind of go over the layers itself. Then you're going to have improvement activities. So on here, I said 2 medium weighted or 1 high weighted activity from the MVP list. Well, it was proposed that they take the medium and high away from those improvement activities. And that actually did pass when the final rule came out today. Surprising, it came out today when I did the webinar. So I am going to refer back to that sometimes. So it still will be 2 activities for a large practice, 1 activity for a small practice, 15 physicians or fewer. And we'll talk about that a little bit more also. But they are taking away the medium and high weighted, which I think is fabulous. And then, of course, the cost performance is still going to be calculated the same, and it's by your administrative claims when it comes to MVPs. So your scorings for the MVPs will align with the traditional MIPS program, so your quality is still going to be benchmarked and you're still going to be scored the same. And then your performance category weights are consistent with the traditional MIPS performance categories when it comes to MVPs. So as I said, you can look at the MIPS value pathways framework here where you have cost, quality, and improvement activities. And then you have a foundation layer of promoting interoperability and population health measures. So we're going to go to the foundational layer, which is the population health measures and the promoting interoperability. So you have your population health measures. You're going to select and submit one population health measure. That is through your administrative claims, and the results are added to your quality score. If you do not qualify for that population health measure, then it is taken from your main 4 measures of your quality that you have. And again, that's all off of administrative claims. And then for your promoting interoperability, great thing here is it's not really changing. Small practices still have an automatic reweight. You're still going to submit the exact same required measures. You're going to submit your EHR's cert. You're still going to do a security risk analysis, a safer guide, and attest to the prevention of information blocking and ONC direct review. So that's really stayed the same, 180 days, everything with that has stayed the same. So if you are a large practice and you are doing that, you're still practically doing the same. If you're a small practice and you're taking that small practice reweight, automatic, still the same. I'm going to launch another poll question here. What is your primary goal for participating in the MIPS program? Are you wanting to maximize your reimbursement, improve patient care, meet regulatory requirements? I just want to meet because that's just what I have to do. All right, so I have a lot of people who is wanting to maximize reimbursement, which makes perfect sense. It's 72%. I have about 20% that just really wants to just meet the regulatory requirements. This is what I have to do. I'm being forced to do it, and I'm just going to do it. And then I have 8% that's saying, you know, other. So not bad. So now let's break this down, the components of the MIPS value pathway. We're going to break it way down into that dermatological care MVP, and I'm going to show you a lot of things that really has to do with that in particular MVP. So when we come to quality performance, as I had mentioned before, you're going to select 4 measures, including 1 high priority or outcome measure. So previous in your traditional MIPS, 6, one high priority or outcome measure. Now you're going to do 4. But the thing about it, you're not going to have this huge list to choose from. They're giving you the list to choose from, which I have it listed here, and we're going to go over a few of them. When I went through this and looked at it, I have worked with a lot of dermatologists and a lot of plastic surgeons when it comes to MIPS. And a lot of these measures, a lot of my clients are already using. So I was very excited about that because a lot of them are not really new measures. So it should be pretty simple to transition over. One thing that I do want to say is same thing with traditional MIPS. When you're tracking your measures, you don't typically track just 6 measures, right? Because you want to make sure that you have enough measures that if something happens to a measure and you have issues with it or you're not documenting it properly, you have something else to choose from. Same thing here. You have to submit 4 with 1 being a high priority, but you always want to track more than that in case something happens with a measure. You don't want to be caught just with 4 measures and that's all you have. So we'll look at some of these measures. So like 410, a lot of practices are already doing 410 psoriasis clinical response to systemic medications. So as you look at this list, you can see there's probably a lot of things that you're already tracking at this time. And you can take what you're already tracking and look back at your previous year and go, okay, I did pretty good on that measure. So I want to still track that measure because I'm already doing it. My clinic knows they're doing it correctly. My doctors are doing it correctly. I'm scoring great on it. And so I'm going to use that. We have 485 and 486, psoriasis and dermatitis improvement in patient reported itch severity. Some other ones is AAD6, skin cancer biopsy reporting time, clinician to patient. I know I have a lot of people that use that. It's a pretty simple measure. And then we got the AAD12 melanoma appropriate surgical margins. But then we also still have 130, documentation of current medications in the medical record. And 226 was just preventative care and screening tobacco use, screening and cessation intervention. So those are just some measures that I'm putting out there that I know a lot of the practices that I work with are using, and I think they do really, really well on those measures. I did list the 2025 proposed and modified MVP guide here. That was the actual dermatological care MVP from the site. I just thought maybe it'd be helpful if you wanted to go to it. But the final is out, and it's pretty easy to find. If you go to the QPP, you can actually type in this MVP, and it should come up for you if you want to really look at it and break it down. But I did break it down quite a bit here in this webinar. So if you look at these measures, you'll see your collection types. You're on 410, you have a MIPS CQMs as your collection type. But if you look at 130, documentation of current medications in the medical record, you have collection type, but there's two of them, which is an ECQM and a MIPS CQM. So electronic clinical quality measure, an ECQM is one that we can, NextTech can use within the software. So if you are still using that measure, you can still use that within your software. So when I go to the next slide here, you'll see quality submission types, and NextTech offers ECQM reporting for this MVP for 130 and 226, which are available within the software. And then other measures can be reported from the DataDerm or the Polaris registry. So DataDerm being if you are with the AAD dermatology and you're able to do that. If you are a combined specialty with dermatology and plastics, then you're, if one of your dermatologists is using that registry, those plastic surgeons can be added to that registry. The AAD will allow that, so just something good to know. And then if it is plastic surgeons only practice, your academy doesn't actually have its own registry at this time. So the Polaris registry is one that I've been using for my clients, and they are integrated with the NextTech software. And then this is just our quality CQM reporting screenshot that we have that is within the software. Again, when it comes to your MVPs, you can still do that dual submission where you use a little bit of ECQMs out of your software and then a little bit from the registry and mix those together to get your highest score. So when it comes to our improvement activities, they give you a list of what's available. So there's 106 improvement activities out there. So there's a lot of times my clients, I'll give them a list of 10 and I'll say, these are my top 10, and none of them work for their practice. And they go, okay, well, let me just look through them. And then I hit that Excel spreadsheet and I'm like, well, there's 106 of them. And everybody just kind of gasps a little bit like, oh, 106. So it is a little overwhelming. But now with our MVP, we have a smaller list. So it's not as overwhelming. CMS did propose to remove the activity weightings, which is what I told you earlier. That did get approved. So no medium, no high weighted activity. And you can choose from this list of what activity you want to use. The thing about it though is if you use this MVP, you have to use something off of the improvement activity list. So if you have to make sure there's something here that you're doing that you can use from this MIPS value pathway. And then we go to the promoting interoperability. The foundational layer must submit the same promoting interoperability measures required under traditional MIPS unless you qualify for reweighting. So again, I'll go back to that reweighting. If you qualify for a reweight, small practice, 15 physicians or fewer, is going to qualify for that automatic reweight. If you, for some reason, take an EUC, uncontrollable circumstance for this category, you're going to have a reweight. And then you have your population health measure. So CMS was proposing to remove the requirement to select this measure during registration. And these are calculated through administrative claims and will be scored as part of your quality category. So that is how that works when it comes to the population health measure. Again, just remember, as that large practice, if you are needing to report on promoting interoperability, 180 days, you want to make sure a SAFER guide is done, a security risk analysis is done, and everything that you were doing previous, that is completed if you're using that MVP. And then the cost. Cost, again, I put the melanoma resection on here because a lot of people get hit with the melanoma resection for cost. It is calculated by using the administrative claims. There's not a benchmark on it throughout the year. It's current year data. When you receive your cost performance feedback, it's normally in June when the prelim score comes out, and you can kind of see it then. And then all of your other information comes out when the final score. So just know this is still considered part of an MVP when it comes to cost. Something different when it comes to MIPS value pathway, you have a timeline. So this is the 2024 timeline for the MIPS value pathways for 2024. So if I was going to do a MIPS value pathway, I have to register for it. So unlike traditional MIPS, you're you check your eligibility, you're eligible as an individual or group, you're still eligible that way. But if you want to use the MVP, then you must register. So registration opens April 1st, 2025. And then it closes December 2nd, 2025. Now, the great thing about this is, if you register in April, and then you want to make some changes, say that it's something that you didn't want to do, or something happened, or whatever, you can go back in and edit that and change it if you wanted to before December 2nd. So just keep that in mind. It does close at 8 p.m. Eastern Standard Time. I like to reiterate that because it's kind of the same thing when it comes to attestation. When you go in, this is how you're going to register. I just kind of wanted to show this. There is a great how-to on this on the QPP website, but a couple of things that I really wanted to point out when you are registering is you must be a security official to register for an MVP. So if you go in there and everything is grayed out and you cannot register, it's because you are not a security official. You are considered a staff user role. That's your role. So to register, you must be a security official. If for some reason you are not and you don't know who is within your practice, then you do need to reach out to QPP and let them know kind of what's happening so they can change your role or tell you who your security official is within your practice. So once you do log in and you are the security official, you are going to go to registration tab under the navigation window, and then click register or edit an MVP registration. So if you've already registered and you need to edit, of course you're going to edit. And then you can register for the MVP that you're wanting to use. Here's just a screenshot of someone that has registered and kind of the questions that it's going to ask you of how you're going to have to fill it in when you register. Sometimes it's just nice to be able to see things that has been done before. So this is just showing kind of some of the questions that they're going to ask you when you go to register for an MVP. So now we're going to talk about the benefits of using MVP versus traditional MIPS. Why are we going to do MVPs and versus the traditional MIPS? Well, for one thing is it's going to better prepare you for the future of what is coming. I always tell people this, I say it's a MIPS game. This MIPS game is always going to change. And as you know, if you've been doing this for quite some time, we went PQRS, meaningful use, MIPS, and now we're going to MVP. Well, traditional MIPS is going away. So get yourself prepared. Don't wait until the last minute to say, hey, I'm going to do MVP because I'm forced to. You can be prepared for that. It's specialty specific. They've listened. CMS has actually listened. It's taken some time, but they have listened. They've tried to ease the reporting burdens for you, and they've tried to give you less things to choose from. And I was very surprised of the measures that are on there. I thought that they were great measures. I thought that the improvement activities were great. All of those things are measures that my clients that I'm working with are using. So I feel like it's going to be a pretty simple transition. So some of the questions that I wanted to make sure that we answered here is, can I report traditional MIPS in an MVP? Yes, you can. So you can sign up for an MVP and still submit traditional MIPS, and you'll get the higher of the two scores. So it's kind of like when you're testing as a group and you're testing individually and you get the higher of the two scores. Well, that's what's going to happen with the MVPs. So a lot of times people get nervous going into something new. I want to do this MVP, but I'm really, really nervous because I can't afford to take a penalty. And what if I don't do great? It's my first year. Okay, well, you're going to track more measures anyways. So track enough measures so that you have an MVP and you have enough measures for your MVPs for quality, and you could submit traditional MIPS and then you get the best of the two scores. To me, that's the best way to go. You have a backup. You're going to do okay. You've done traditional MIPS in the past. Now you do both. Now that you know that you're great with that MVP in 2026, there you go. Do your MVP because you did great the year before, or do both again. However it is, if it's still available, do it. You plan to submit data for MVP and traditional MIPS. Do I have to submit my data twice? Yes, you must submit a separate set of data for each reporting option. So MVP and traditional MIPS. You can use the same measure or activity to fulfill it, but you have to submit it differently. So you'll have an MVP section and you'll have a MIPS, a traditional MIPS section. And you will notice if anyone now on this webinar is using the Polaris registry when it comes to plastics, you will notice that there is an MVP section on there already because there was MVPs available. And you'll see that on the Data Derm registry also for the 2025 reporting year. If I submit data via multiple reporting options or participation options, do I get multiple final scores? The higher score wins. That's what's important. Give yourself options because the higher score will be what your final score is. Performance feedback. No confusion needed here. Same performance feedback timeline as traditional MIPS. You're still going to get that preliminary feedback in normally June. Sometimes they say June, but it normally comes at the end of June. And then you're going to get your final score August. And then we'll have the incentive or adjustment that you're going to receive at the end. So how do I stay up on top of these changes within the QPP program? So all of this is things that come from the quality payment program. If you do not have a login to that quality payment program, you want it. That's where you're gonna, even if you're submitting using our registry, you want to make sure that you are going in after you submit to QPP to make sure that your data is there, because that's where CMS is going to pick that up. It's from QPP. So on that QPP site, sign up to receive the CMS email updates. Do what you're doing now. Attend training webinars regarding MIPS and regulatory topics. Everyone here right now is doing everything that they need to do to keep up with what is happening. Confirm you have the description with Next Tech Compliance Corner, and you can always ask for help and hire a MIPS expert. We love to help people when it comes to MIPS. It is exciting for all of us, for myself, Heather, Megan. So if you do need help, you can get that. It's not too late for the 2024 reporting year. So just keep that in mind. Main goal here is to not receive a penalty, or as less of a penalty as possible. And then how do I monitor my MIPS score and my MVPs to max out my points? So it's going to be the same way. Don't change what you're doing. You still need to make sure you're monitoring. Just because you're doing an MVP doesn't mean you need to change anything. You still need to monitor and make sure everything looks good. So you want to run those quality reports monthly and confirm your MIPS scores or your MVP scores. Run your PI reports monthly and target the best 180 days. Address your gaps quickly. They grow faster than you think. So, you know, a lot of times when I see gaps, it's from my clients who have had staffing changes or just short staffed. I noticed some gaps in there. So it's just good to monitor that monthly because I can see just a slight decrease in that measure. I know something's happening. Train staff and follow up to ensure they are being consistent and continuously check in with your EHR vendor for updates on regulatory items. So that's why we want to make sure that you are getting these webinars, logging into these webinars, seeing if you're getting that compliance corner letter. So we just want to make sure you're staying up as much as possible. And then, of course, as I said, it's not too late to ask for help for MIPS 2024. If you're struggling, if you're having issues, please reach out so that we can get you some help when it comes to that. So I'm going to launch one more poll question here, and then we'll start getting to some Q&A. And I'm going to hit launch here. Do you plan on using MVPs for the 2025 reporting year? So how do you feel? This is going to be my my test here to see if this webinar helped you and made you feel a little bit more comfortable when it comes to MVPs. I am extremely excited about the MIPS value pathway when it comes to dermatology, plastic surgery, because I work with so many clients in those specialties, and it is difficult sometimes when we're using measures that are not relevant to those specialties, and it is frustrating for the staff or for the providers. So I'm pretty excited about it, especially with the measures that are listed. So right now I have about 75% saying yes, and 25% saying no. But again, I wish I would have added one thing to this of if you're planning on doing traditional MIPS and MVPs, because I think that's important also. I want you to keep that in mind. Make sure that if you can do it, just submit both, and that way you get the best of the two scores. It works out great. So about 76% is saying yes, 24% is saying no, which I think is great, because when I've had the poll at the beginning of the webinar, I had a lot of people say they weren't familiar with MVP. So this makes me happy as to know that a lot of you are saying yes after viewing this webinar. So I'm going to close this poll, and I'm going to invite Megan and Heather into our webinar now for a live Q&A with your MIPS experts.
Hey there. Good job, Christine.
Hello. Thank you. Thank y'all for joining. So I hadn't looked at a whole lot of questions.
Yeah, most of them wanted to know about the recording and being availability to have it after, and there will be an on-demand link that's sent out. Also, yes, I think we clarified on the AAD measures. You do have to work through DataDerm, the registry, for their specific measures, and I think you clarified that. One of the next questions, it looks like you're currently using IntelliChart Pro or NextTech EMR. The reports we run really don't show any usable data. For example, it does not show the current scores. I would probably want to check base of where you're running your reports. The ECQM reports will give a numerator denominator that you can then put into a percentage for performance. So I don't know if you can give any further clarification if that's the reports you're talking about, but just that was a quick one. So here's another one, Christy. Have we heard if they'll be removing telehealth from our billable services and becoming more of an option when COVID happens?
What was it again? I'm sorry, it cut out a little bit.
sorry, I'm on my phone because my audio, but it says, have we heard if they'll be removing telehealth from our billable services since it became more of an option when COVID happened?
Have not heard of that as of now. We can do a little bit of research into that though and see if we can find anything on it, but I haven't heard anything on that at this time. And they still have an improvement activity for telehealth as far as the MVP. So that is part of the MVP, but I haven't heard anything on it at this time, but we can always get some more information and get back to you on that.
Yeah, I'm pretty sure there's been in the final rule in payments, there were some adjustments to some of the telehealth billing codes, but I don't think it's been completely removed.
And then I just want to make sure, because someone has put in here, we are currently with IntelliChart Pro. If you are ophthalmology, if you were on this webinar, this was strictly for derm and plastics, but great news, we have the ophthalmology webinar right after this. Megan is going to do that. It's going to be a fabulous webinar. They're going to break down the ophthalmology MVP. So if you can join that one, or if you signed up for it, you will get the on-demand copy of it in about a week. So I meant to mention that at the beginning, but if you did, we will have that next webinar coming up.
We have another question about, will Nextech ever lower the cost of entry for MIPS guidance and support? I'm assuming of our MIPS master and monitor packages. And we love the feedback, so we will definitely take that back to our teams. Our service model is a very hands-on, white glove service model from A to Z. You really get a very full package of support. So if you needed even further details on what is included, that validates the pricing. I know we can get you a little bit more information there also, just to make sure that we're clear on exactly what you call, entry level support for MIPS. Anything to add there, Christy, Megan?
No, I think that is I think what you said is great. I will add, when it comes to those fees with it, you do get that lot. You do get one of us every month. Everything that you need is there. Experts with the software on top of that. So there's a lot of things that come with it. But we'll definitely take that back to who we need to. Heather, I have one here that I was going to read to you. If a specialty has been excluded from previous population health measures, MVPs seem to be a wild card for cost. Any insight?
Sure. So this is one of kind of the big, I would say, differences in MVP versus traditional MIPS. For the MVP, you're only going to receive the cost measure that is included in that MVP. So if you noticed in the derm MVP, the only measure was the melanoma measure, and that would be the only cost measure that would be included. So any previous total per capita or the MRSB measures would not apply under MVP versus in MIPS, traditional MIPS, you're scored on any that are applicable.
Perfect. And then I had one, do we have to register for MVP? Yes, you must register if you're going to use an MVP. If for some reason you're wanting to use an MVP in the 2024 reporting year, say there's something out there that you wanted to use, you have until December 2nd to do that of 2024. If for 2025, if you're wanting to use an MVP, you're still going to get your strategies together in January, know exactly what you're going to do, but you will register for that April of 2025. And that registration will stay open until December. So anywhere from April to December, you could register. But if you needed to make any changes, say you registered in April and you needed to make changes, you could do that up until December 2nd.
And the main thing you're doing when you are applying or you're registering is you're electing the claims-based measures so that they can begin tracking those measures on the back end. That's kind of one of the big differences is the claims-based measures that are involved in the MVP versus traditional MIPS. And by having to elect which measures you want to track, it just gives them headway for that registration.
And then just remember, ophthalmology webinar is next. MVP ophthalmology webinar is next. I've just had some people ask that. So yes, there will be that webinar coming up. We answered the one about the recording. How can we get a copy? So you will get a copy of the recording. It will be sent to the email that you signed up for this webinar, and that should be within the next week.
Yep, and there's two more that looks like they just popped up in here. Is the MIPS portal or service an inherent function in NextTech, or is there a payment to access MIPS in the software? So the MIPS in the software, the ECQMs, which the portal function to me is the access for the patients that's creating portal codes. I do believe the portal is a component of the system. And then the ECQMs also, which would be your quality measures, are also an inherent function in the software. The portal itself is obviously what they're logging into, but the generation of that portal code and giving them the access to it is within the software. If I've understood that correctly, Dalton.
Yes, and I'm going to add to that just a little bit. So there is, you have to, it's a global preference of assigning a portal number to every patient, every new patient. So when a new patient is created, it'll assign that portal number. So you want to make sure that's set up. You will notice there may be some, if that wasn't set up for some reason, you need to mass assign some numbers, because if you're give patient access to the medical records within those 4 business days is low, and you have merging of the clinical summaries turned on, automatic when signed, and you have everything set up, it may be that you need to do a mass assign. So that's just some extra tips there on that.
And then Lori Brown has a question. Population health measures have no effect on composite scores. So the way that they will work is there's 2 of them. In the current rule, you were to choose one of the 2 that you would be scored upon. In the new release today on the final rule, they are now going to track both of them, and then you would receive a score on the population health measure that you did better on. It as far as the composite score, it becomes a 5th quality measure in the quality component of MVP. If you do not meet the threshold for either one of the population health measures, then you would only have 4 quality measures versus the additional 5th for this population health measure.
And I had one, sorry, I must have missed. Do we register in QPP for an MVP? I want to go over that one more time. Yes, you must register in QPP for the MIPS value pathway, and you must be a security official to do that. So if you are a staff user, it will not allow you to. It will be grayed out. So just keep that in mind.
And I think that is all of them. And I know we're right up on the 3:45 mark. So hopefully everybody has their questions answered and got some great information today on the MVP. Thanks, Christy.
All right. Thank you for joining. I hope that you like the webinar. And again, ophthalmology is coming up next, and Megan will be presenting that. So we will all be back on that webinar if that happens to be your specialty.